All participants keep their audio and video off during the presentation. We will be ensuring that they're off during the presentation. They will be back on during the question and answer period. So without further ado, please welcome Dr. Karlee Silver.
Just making sure I've got all of my things in order. Can you see the slides okay again? Amazing, cool. Well, good morning to everyone. I'm really honored to be here today and looking forward to sharing a little bit of the path that I've been on and also kind of, I would say maybe challenge you a little bit in terms of the kind of messages I wish I knew when I was finishing my undergrad for the path ahead. I'm going to tell a story, and I can still tell my story as like a really beautiful straight line right now. You know, from where I've been to where I've got to. I can tell it as, you know, I grew up in a middle-class family in Winnipeg. Both my parents had university degrees. My maternal grandparents even had university degrees. I went to the University of Winnipeg to study biochemistry. I received a Rhodes Scholarship. I went to Oxford to study my PhD in genetics and immunology and really looking at autoimmune diseases. I did my postdoc at the University of Toronto in a lab focused on how the body responds to malaria. Started working at Grand Challenges Canada as a program officer, and now I'm co-leading it. And last year, I was named one of Canada's top 40 under 40. But that simple narrative, while it may be easy to say now in retrospect, leaves a bunch of things out that were messy and important about the last 40 years. And these include things like I had a parent with a mental illness that shaped my childhood. 50% of my teenage and early 20s were spent rowing competitively. I declared my my degree focus in undergrad at the last possible moment and really was completely guided by what I found interesting on a course by course basis. I lived in a feminist environment and was really oblivious to the kind of oppression that women can feel until I found myself at a university with a 500-year history where women had only been admitted for the last 20 years of those. And I found myself at events where I was regularly ignored simply because I was a young woman. I found a group of peers for the first time when I was at Oxford, many women, some men, and all of them are really embodiments of support and love. I had no idea what I wanted to be when I grow up. So after I finished my PhD, I took almost a year off. I traveled through sub-Saharan Africa, just being. I wrote 7 letters to people across North America whose work I admired and ended up choosing one of them, choosing the one that I went to do my postdoc in, mostly because it was based in a beautiful building in Canada. I had my heart broken and broke a few hearts and found a new Canadian community being back in Canada. I still had no idea what I wanted to do when I grew up after my postdoc, but I took an opportunity for a summer contract with a couple people who were starting a new organization focused on global health innovation, and I stayed. I've battled and lost to burnout. I started practicing yoga and came back to Grand Challenges Canada to continue to sort out how I can be kinder to myself. About 4 months before I was named co-CEO of Grand Challenges Canada, I told our board chair that I didn't want to lead Grand Challenges Canada, but ended up applying with my co-lead. And I'm now almost 3 years into co-leading this innovation platform that has a budget of about $50 million a year. I got engaged in the middle of a pandemic, and I still don't know what I want to do when I grow up. And because of the fact that through this, I've stayed really curious, though, I have a lot more understanding of who I am and what's important. And a few of my truths that are really relevant to this story today is that I really love science. I love how we can test hypotheses, how we can use knowledge to make our communities more equitable, healthy, nurturing. I love how we can go from a new virus popping up and becoming a public health emergency of international concern to having effective vaccines that are starting to protect people. It is fascinating and it's inspiring and it's complicated. And this is really what drives me. I'm also a fierce feminist. I believe in the social, political, and economic equality of people, regardless of their gender, color, size, whatever. I see how some messages that I've internalized from society about being a woman are super empowering. I see others that are really limiting. And I see these similar dynamics play out in the women on my team and in the women innovators that we support. And it really makes me want to change that narrative. I've been able to marry a really strong scientific training with this feminist root that I can only thank my mom and grandparents and aunts and such for instilling in me, to help bring a unique offering to the world through my work at Grand Challenges Canada. So my first message is really be curious and be you, but it takes a while to figure out who that is. So give yourself the time to do that. The second point that I wanted to bring, and sorry, I'm struggling with my notes here. There we go. Is on my path, I've really encountered a lot of people who were really comfortable in kind of tinkering, who enjoyed the process of science, of inquiry, of things like this, regardless of the outcome or the unique link to a greater world. And these are beautiful people, don't get me wrong. However, if your goal is to take your scientific training and to help shift the world for the better, the best way to do that is to keep focusing on the big outcomes. Focus on the big things because everything else is small. And if you really want to have impact, you're not going to happen upon it by focusing on the little things. At Grand Challenges Canada, this is exactly what we do. We focus on the big things by focusing on what we call grand challenges. And these are one or more specific barriers that, if removed, would actually change the likelihood of a global impact through widespread implementation. And the benefits of us putting these challenge statements out there is really we can be super focused on the big things. We can attract the best minds to the table, regardless of what they were trained in, right? Who they are. They might have never really understood this part of the problem before. But if we can do our job well, they will start to understand where their own skill sets can be brought to bear to solve this problem. It builds and strengthens the capacities of local communities and communities of innovators. So we're not interested in kind of the solo flyers who are really amazing people, but what we do is actually treat innovators as a community and help them learn from each other. It helps to capture the interest of the media and the public, which for some of these topics is really important. And it also helps serve as a platform for global health diplomacy and global governance. And in these days and ages of when kind of nationalism is rising because of scarce resources, like these days, I would say the access to vaccines would be one of the things that really are causing countries to look internal and to be self-protective. These types of platforms that actually are purposely looking outwards and figuring out how we work together are very, very important. So at Grand Challenges Canada, we focus on a few different things. We're an innovation platform that seeds and transitions to scale bold scientific, social, and business innovation to drive sustainable impact at scale. So that in a nutshell is what we do. What we really do behind the scenes is take large amounts of money from large donors, Government of Canada, other country donors around the world, and are able to translate that into support, both financial and non-financial support to innovators who would never be getting that capital in the first place. And so this tends to be that we focus on people who haven't traditionally received grant funding. But this also means we're unlocking ideas that have never really been brought to the global arena to help solve some of these problems. I'm going to fire through a few of the examples of the grand challenges that we focus in. They're really in three different areas: global health innovation, humanitarian innovation, and most recently, Indigenous innovation. Our global health innovation portfolio, you can see, spreads across 7 different areas. And then we have our stars in global health that helps take in ideas from all over the world across those areas, depending on the year. But these range from focusing on increasing the access to care in mental health, to focusing on how do we get appropriate medical products and technologies distributed in an equitable fashion across areas that are in need. It looks at different models to deliver primary health care and sanitation services, so that we're not having to replicate some of the old archaic ways of sewering entire cities. If we think about the way that no one carries or no one has landlines anymore because we rely on cell phones, we're essentially trying to do the same thing with sanitation and not have a sewered system, but instead, what are the kind of container-based ways that do this in a much more effective way? We focus on some of the trickier issues like access to safe abortion and sexual reproductive health and rights, including how to reduce sexual and gender-based violence. And we look at how to nurture children in the first 1,000 days of their life so that they grow, their brains grow, and they have the capacity to reach their full developmental potential in our Saving Brains program. For our humanitarian innovation, this is a partnership with several governments, including from the US, the UK, Canada, and the Dutch. And this is focused on creating hope in conflict. And so it's really focused in conflict regions and looking at what are the needs and what are the unique ways that those needs can be met. A lot by actually focusing on the experiences of affected communities and their own resources to be able to save and improve their communities' lives. We focus across water and sanitation, health supplies and services, life-saving information, and energy. And finally, we have the unique opportunity that a couple of years ago, some Indigenous leaders came to us and asked if they could use the platform of Grand Challenges Canada in order to launch an Indigenous innovation initiative. So we host, incubate essentially this initiative at the moment as it's getting up and running. They launched their first seed call last year in the middle of a pandemic about advancing Indigenous gender equality. And they're really focused on how do you build social entrepreneurship and innovation ecosystem within across First Nations, Métis, Inuit communities in Canada in a way that can actually really transform and change the kind of inclusive economics of the country. So these are the big things we focus on. And we do it with a lens always to be focused on the lives saved and the lives improved of what we're doing. Before we invest in things, especially at the larger scale, we convince ourselves that we're going to be able to see the path to where this has the potential to save and improve many lives. And you can see those kind of models that we do rolled up into these numbers, where by 2030, we expect to save about 500,000 to 1.78 million lives. And we can expect to improve 20 to 64 million lives by 2030. With the innovations that we are currently funding and helping them reach their full scale and sustainability. To date, we've had the innovations we support have saved about 38,000 lives and improved 9 million lives. And we're very proud of this keen focus on this outcome and think it helps us stay focused and stay focused on what really matters. I think it's important to mention that throughout all of this work we do, we're also on a journey of decolonization, learning from and with our staff, innovators, and communities as we do so. We understand the concept of decolonization to mean questioning asymmetric power structures, listening to voices that have historically been ignored by those with power, and challenging the assumptions that Western or first world ways are superior. We also acknowledge the fact that international development and humanitarian assistance work is rooted in a historically colonial context, and as are the interactions with First Nations, Inuit, and Métis people in Canada. So this is big work that we're doing that is kind of the silent stuff in the background, But I would say it's probably the thing that is driving a lot of the innovation internally in Grand Challenges Canada at the moment in terms of how we do what we do. So that's my second message, focus on the big stuff. The last message I have for you today is to be brave, because your ideas do matter. If there's one thing I could tell my younger self, it would have been this, is that my ideas mattered. It took me a long time to stop kind of censoring my own voice, to actually speak up, to realize that the question that I had in my head but didn't ask, that came out from someone else's mouth 5 minutes later was actually probably a good question to ask. And that I shouldn't have been worried about whether it was good or not, but rather, did I actually honestly feel curious around it? And I realized over the last while that the people who listened when I did speak up and acknowledged my contributions and amplified what I said made all the difference to me being able to keep speaking. And so this realization has helped drive who we fund at Grand Challenges Canada. So I'm not really that interested in ideas that always get the spotlight. I'm very interested in ideas that are unique and that come from people who live the challenges that we're looking to solve every day. And because we think, and like embedded in how we do our business is that we really think that those who are surrounded by the challenges are best suited to come up with sustainable solutions. So over the last decade, almost 11 years now, the innovators we've supported are inventive, passionate people with the lived experience and knowledge to build transformative solutions that improve and save lives. We spend a lot of time and attention in inviting in diverse innovators to apply for our support because we believe those closest to the challenge are most likely to come up with sustainable solutions. And this time and attention is paying off. 30% of the humanitarian assistance innovations that the Creating Hope in Conflict Grand Challenge brought in are led by individuals who are members of conflict-affected communities. 40% of the innovations we support are led by women. 60%, over 60% now, of the innovations we support are led by innovators in low and middle income countries. 85% of the applicants to the first Indigenous Innovation Initiative funding call were women or two-spirited. And 90% of the of the mental health innovations recently selected for seed funding through our Global Mental Health Grand Challenge are led by young people. As such, we provide innovators from around the world with resources that they would otherwise not have access to, such as funding and links to networks, both local and global. Their bold ideas may start small, but with the right mix of resources and thorough methods for testing and scaling, we support them to have big impact. And I'm going to tell just in the last few minutes a couple of the stories that help to show what of those 1,300 plus innovations, what do they really look like at a local level? So this one is a Burundian innovator. We don't get a lot of innovations from Burundi and West Africa generally. We are looking to change that with some actions over the next few years. So we hope to see more and more of people like Grace in our innovator community. But Grace runs an innovation or social enterprise called Sakode. And it's really focused on washable and reusable sanitary pads. And there's a really, fundamental reason why access to sanitary products, to menstrual hygiene is actually something that is necessary for empowerment of women and girls. It keeps them in school when they're menstruating. It keeps them confident. It's an entry point into having conversations around sexuality and sexual and rights and health. And so this is one that we've taken seriously, but it's also a really interesting example of where you can actually have a social business that is tailored to the needs of a local population. the kinds of sanitary products that we would find if we went into a Shoppers Drug Mart or something today can be found the world over. However, they are usually extremely expensive and often not at all meeting the needs of the girls and women who are in those areas. And an example of that is in Burundi, where many of the girls who actually use the pads that are made by Sakode don't have underwear. Over 80% of the women don't wear underwear in Burundi, mostly because of a paring down of what is necessary when you're looking at where kind of scarce resources go. They're like, yeah, underwear is not the place I'm going to put this. But in response to that, it means that a lot of the products that have been developed with the concept that women are wearing underwear don't work. And so that's where you see the innovation and this tailoring of an approach to actually have menstrual pads that have strings, so you can wear them without underwear. They're reusable, so they can be washed and reused, which is both environmentally friendly, but also helps in terms of the cost that would need. And Grace actually looks at engaging women and girls to work in these social enterprises. They will produce and they will sell the pads, and they're helping to change the stigma around menstruation. And also they engage adolescent boys in this process as well. And so what we've helped Grace to do is to refine her both the education part of her work and the engagement of boys, as well as the financial sustainability of her enterprise, so that she can be a long-lasting member of the economic society in Burundi. Interestingly, this local kind of manufacturing is also really critical in the kind of last year that we had, where the ability to create products that no longer are being shipped around the world is really critical. And we provided some supplemental funding for Grace because the machines that she uses to create the menstrual pads could actually be retooled in order to make masks that could be the equivalent of N95 masks for the COVID pandemic. And so a lot of her efforts over the last year has been serving the healthcare needs for PPE in Burundi. The last one I'm going to talk about here, oops, we'll get to there, is Akili and Me. And this is from Ubongo, which is you could think of as a Eastern African version of Sesame Street. And it's really a locally produced and culturally relevant, multilingual, multimedia edutainment kind of thing for young children and caregivers. It has messages around that promote numeracy, pre-literacy, language and motor development, social and emotional learning, and health and well-being. If any of you have kind of heard the messages around, who speaks, what characters speak in different TV shows, the importance of making sure that kind of women representing or girl representing characters, or getting lots of time to speak, as also the kinds of questions or the kinds of ways that they talk are very important to shaping gender equality around the last few years in the early years of a child's life. And Akili and Me really pays attention to these gender dynamics. They've been able to reach almost 2 million children over the last couple of years. They are, since the beginning of the funding we've given them, they have launched in Nigeria, in Malawi, in South Africa, Zambia, and Swaziland. And they are looking to launch in Ghana and Botswana soon. And so this is the kind of thing that we can be actually seeing impacts. They have measured the amount of screen time, essentially, watching Akili and Me that a child would have to watch in order to have increased developmental outcomes. And they have been, this is not a ridiculous amount, don't worry, but it is something that is a light lift and highly scalable, but that is actually having developmental impacts for these children. And so there's an exciting way, this is an example of an exciting way we're testing out what are the bounds of how we approach different things like early child development in ways that capture the imagination and can be much more scaled than traditional kind of face-to-face approaches. So those were the three things I really wanted to talk about. Be curious and be you. To go and focus on the really big challenges in the world, and to be brave, because the kinds of ideas and thoughts that you have percolating in your head, no one else has. And so make sure that the world pulls them out. And what I'm hoping to do and trying very hard to do is to set up a system and a structure where we are listening for those voices. We are actively going out and finding those innovators that haven't had the chance to test their ideas before, and giving them that chance so that the world can be a better place tomorrow than it is today. I'm going to end there, but really happy to take questions or to hear any thoughts or reactions that people have. Thank you.
Thank you, Dr. Silver. So as she said, we'll open the floor to questions. You can also turn on your camera and use your microphone as well. So yeah.
I know it's Saturday morning. Everyone's still waking up. So.
I guess I can start if no one else has any questions.
Yeah, go for it.
So certainly from what I've heard, you have a strong background in genetics, immunology, and lab medicine. Have you been able to apply any of those skills in your role as a CEO?
Yeah, it's a great question. So certainly I don't use a pipette nearly as frequently as I used to. But the kind of work that we do that is really focused on building evidence for innovations draws on a lot of my scientific training of how would we design experiments that show evidence. What is kind of the levels of evidence that we're looking for, and what else can we pull across from what's already known to help build the case for certain innovations. So that kind of training certainly comes in handy. I would also say that some of the things that maybe were a little bit less obvious to me when I started as being transferable skills are ones that I actually use much more frequently. The idea of being curious is a very strong trait for most managers, and being able to actually have dialogues with the team and with innovators that are led by curiosity rather than judgment is a really important one. And then I also think that the ability to kind of plan out, what are the 5 steps down the line is something that often scientists are trying to chip away at small parts, but they see where it's supposed to lead. They understand, they start piecing that together in a way. And I think that training and the ability to plan experiments, to plan scopes of work has been things that have been very helpful. And then finally, with my training, I'd worked in a lot of international collaborations, and having to work across different cultures and time zones, and making sure that that everyone is coming together and getting what they need out of it are very important skill sets for any sort of collaborative work. We do a lot with, as you can imagine, across different countries, and needing to be culturally competent and aware of what's happening in someone else's mind, and being able to, again, be curious and tease that out without making assumptions are things that have definitely come from, I can think back to specific times during being, when I had my lab coat on rather than my CEO hat on, that were very much being honed then.
I also have a question from the presentation. So one of the things that you said was that Grand Challenges Canada like puts funding towards projects that like look at the equitable distribution of resources. So what does that look like? Because I'm always kind of curious about what exactly that would look like. I've heard it in my classes a lot, like equitable distribution of resources is like very important in terms of global health, but like I've always wondered what that looks like, what process that is. So maybe if you could like describe it.
It's a great question, and one that probably we could have hours-long conversations about, because there is a lot of nuance to it. But I'll give you two specific takes on it. First is that when we're looking at, so 10 years ago when we started, if you looked at who was receiving funding for either new ideas or development projects, global health projects, often the money was flowing to high-income institutions, who often, good ones were absolutely partnering with low and middle income country leads, were working in collaboration, we're doing a lot of capacity building, things like that. But one of the first programs that we put out was, we said the lead of those collaborations had to be in a low or middle income country. And so that power flip of being able to, even though it may be the same people working together, the person who is holding the signing power, the money distribution power, has flipped for the first time, sometimes in decades, in those partnerships. And it's not to say that there's like a vengeful or anything around that, but the ability and the empowerment that comes with being able to be the decision maker is a real one. And one that we heard from innovators was a very monumental switch. And so that's one example of our prioritization of innovators who are based in low and middle income countries, is one way that we are looking at how to make the distribution of resources much more equitable. So that's one. So we're prioritizing a certain group of people who haven't traditionally been able to be the grant holder. The second one I would say is when we look at the level of the innovations that are being proposed. There's a kind of few different ways you can think about innovation. You can think about, we all probably are holding some sort of cell phone in our hands, and this is probably like, this one's version 8. I've got, another one that someone's probably got a version 12. Like, there are these incremental things that can be done, but they're not really changing who it's for. They're just kind of incorporating new ideas, new technologies into it to make it better for the people who are already using it. There are other things that are really like speaking specifically to a very new group of people. And for us, we're really more interested in that second type of innovation. So how can we, and there's actually lots of others, but I'll make it simple for here. That idea of how do you design for people who have never actually been designed for? So rather than thinking about the masses of like, who's your average customer that you're thinking about, or who's your average person that you're going to be, that's going to use kind of a health service, if you can focus on this group of people like Grace did in Burundi, the girls who don't have underwear, what does that look like? So then what are you going to design for them? And that's the kind of innovation that we're most interested in. So who are the people whose the solutions have never been designed for them? But it doesn't mean that they can't be. It just means that they haven't been the ones at the forefront of people's minds. And if you start there, it's often easier to be inclusive for others. And so that's the difference, is rather than going from kind of your average person, middle class, working in a city, has job, etc., could you design for the person who doesn't have those things? And there's lots of times where actually that same solution can be applicable.
Okay.
So that's another example of where where we think about the equitable allocation of resources.
Yeah, that makes a lot of sense, actually.
And I think just building on that, I think this is where the who is asking the questions really matters, and why we find so much power in finding innovators who don't fit the classic mold of an innovator, because they actually see the world in a different way than the kind of standard, the usual suspects do. But that brings power to it. What they see is obvious, other people aren't seeing as obvious. So how do we tap into that?
Yeah, I think that's like an important lens to look at the problem, and like for people who see the issue firsthand. I agree with that. Like that's where the innovation would come from. Yeah. In the chat, we do have a question from Madeline. She said, how many people are involved in the designing and implementing the average project, from a co-CEO such as yourself to the individuals receiving funding?
Oh, it's a great question. And hard one to answer. So I would say our team, here's an easy one. Our team this week, we realized we were over 90 people for the first time. That's quite large for us. But that is the team of people who are both thinking through and helping design the funding calls, supporting innovators as they get funded, as well as all the amazing staff that we have who write a ton of checks, make sure people get their money, account for the money, do communications, run our office, etc. So that's our team. And over the decade, that team, or various, we've kind of been from about 25 to 90 over the decade. And we have supported the 1,300 innovators. The innovators look very different. So some will be as small as a couple people. Especially when they first get seed funding, they can really be a couple people who have enough to show to test something. And some of them luckily have wraparound, kind of either an institution that's supporting them, or kind of an ecosystem that they exist in that supports them. But we have also worked with multinational companies. We did a few innovation or few funding things where we did loans. So we got the money back in the end, but we gave some money to Philips, who you probably have a light or something at your house from, a toothbrush. And they were focused on unlocking internal resources for products that could be specifically targeted to low and middle income country populations. And by us giving them a loan, it gave them external focus and external validation that this was a product they could use. A couple of years later, they were able to unlock the internal resources, and we got our money back. And so those are two super different ends of the spectrum. And so there's a lot of people in that second version that were involved. So it varies drastically.
Seems that we have another question from Rebecca Chen. So she said, thank you for the inspiring presentation. Out of curiosity, how do you typically reach out to the innovators in these low-income environments?
Yeah, a whole bunch of different ways. Early days, we actually, a colleague of mine who was Kenyan and worked with us, spent a lot of time in East Africa, traveling around and actually to different universities and innovation hubs, talking to people and explaining them that we're excited to hear their ideas. It was a really good learning for us, because the reception he was getting was kind of akin to maybe what you would sense if you got an email that says, just give me your information and I'll give you some money. Which was not a super trusting one. And so it's an interesting learning for us to understand how we needed to really work with people and build trust with people to actually start even applying, even though it's a light application process. But once people started to see that it was legit, that people were actually getting funding and support, that word of mouth would spread through those networks. I mentioned earlier that we are really interested in developing a much stronger presence in Francophone and West Africa at the moment, because these are areas of the world that have great needs, but also have fabulous innovators that are currently not tapped into many of the global innovation conversations. And so we're really looking at a whole bunch of different tactics, including deploying local consultants who are in those networks to help us spread the word and to help us increase the awareness of these opportunities, and also to feed back lessons to us as to what's the barrier. We definitely take applications in French. We put out all of our things in French, but I suspect there's actually something else that is blocking the ability for innovators to easily apply. And we're going to need to figure out what that is and adapt to it. So a few different things. It's a great question, and it's really the first indicator of success for us as to whether we're doing our job well is whether we're getting a real diversity, geographic diversity, and also kind of institution diversity responding to the calls we have. Because if they're not in that pool, it's hard for us to fund them. So impossible for us to fund them.
All right. I'm sorry that I think we're going to have to cut the question and answer period short then, just because it's almost 10:45. But thank you so much, Dr. Silver, for joining us today and for sharing all of your inspiring experiences with us. To all of our attendees in the chat, if you'd like to join a workshop next, please click on the link in the chat, just the link tree, and join the workshop that you're most interested in. Once again, thank you, Dr. Silver, for your time and all of your inspiring words.
Pleasure. Have a great day, everyone. Bye.
Thank you. Bye.
Thank you. Goodbye, everyone.